The clock is ticking down on the federal fiscal year, and healthcare is navigating some uncertain policy and financial waters right now. This week, we'll get an update on the post One Big Beautiful Bill landscape in Washington. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. In this episode, we're talking with Becky Wifstrand, the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs, about what hospitals and healthcare systems are watching in the nation's capital.
This is always a big struggle for Congress to get all of their appropriations bills done by October 1st. And not a surprise to many people that they will likely not be able to get all those appropriations bills done by the end of the month and instead have to pass a continuing resolution or a CR, which is what you may have seen in the news right now. And there's debate on how long the CR will be and if it will be quote unquote clean, meaning that there won't be any additional policy riders on it. And that's really what the Democrats and Republicans are discussing right now, is what might be included in this continuing resolution. But I think, what's important to remember for this year, given all the political realities and in addition to the budget, there's also some other expiring programs this year. So something that MHA is watching very closely is the Medicare telehealth flexibilities, which also have a September 30th expiration date. And that is aligning with the budget, which makes it even more important this year.
So this year, hospitals have been up against deadline after deadline here. What else is looming on September 30th?
Yeah, so you may have heard about some Medicare rural hospital programs that also have that expiration on September 30th. So the one that is most important in Minnesota is the low volume adjustment program. So this provides some additional funding to obviously hospitals that have lower patient volumes, and this affects 20 of Minnesota's rural hospitals. And this is a really important payment add-on that those hospitals rely on. And again, similar to telehealth, this is something that has bipartisan support, continues to be extended, but Congress has not just made it permanent. And there's just concern if we continue to, get to the wire, get to only a few weeks before that extension, and the rural hospitals can't rely on that funding. So that's something else we're looking at. Also expiring on September 30th is the Medicaid disproportionate share hospital cuts. That the delay of those were something that were included originally in the Affordable Care Act and have been delayed. And if they do go in effect, that would lead to additional payment cuts. And so again, it's just a lot of these policies are just hoping to kind of continue the status quo, but with Congress, acting with a little bit more certainty than normal, we're just not sure if the politics will play out and these will get extended.
So let's dig down a little deeper into a couple of things you mentioned there. We've been hearing about telehealth and the sunset of this regulation for more than a year now. It just keeps getting kicked down the road over and over and over again. What's the status? What's going on with that right now?
Yeah, so just to take a step back, these are the flexibilities to provide telehealth coverage under Medicare that were put in during the pandemic. And so, it's been said before that this is sort of the silver lining of the pandemic, that we've proven how useful telehealth services can be in all different settings, not just those rural settings, which is how the regulations were before the pandemic. And so as you mentioned, this has been extended in the past since the pandemic, but Congress has never taken the steps to make it permanent, even though there is bipartisan support and understanding that this coverage is really important. And obviously, that's really important to our hospitals and health systems in terms of planning for these services to continue. They need to be able to guarantee that it's allowed under Medicare. So Congress has continued to do short-term extensions of this policy, and right now that current extension is set to expire on September 30th, colliding with this federal budget deadline as well. And so, what will likely happen is that Congress will do another short-term extension. MHA has joined national groups in urging for a permanent extension, knowing that this is super valuable. But it will likely be a short-term extension. We are asking for hopefully at least a 2-year extension, just so we're not continuing to have to bring this up every year as something that needs to be addressed.
So we got through the One Big Beautiful Bill. There's some changes to Medicaid and some other programs here. But the Trump administration has been talking about some additional cuts to agencies and other federal spending. Are those going to show up on hospital radar?
Yeah, so that's what Congress is really debating so far. To take a step back, the budget process really starts with the president releasing their budget proposal earlier in the year. And so, to your point, that is what President Trump released earlier this year that had a lot of those cuts to a lot of really important public health funding, a lot of federal research funding that is important for hospitals and health systems. So the president's budget is not a binding document. So then Congress then works through their appropriations bills to, based on those recommendations and makes their own recommendations and obviously come to an agreement. But given sort of the more political complications this year with President Trump's influence on Congress, it's making it more interesting in terms of what you're referring to about those cuts to agencies. So the Senate passed their Health and Human Services appropriations bill. The House is working on theirs right now as well. And it does include some cuts to healthcare programs, but not as much as President Trump did propose.
Now, we saw this spring Senate Minority Leader Chuck Schumer managed to get those 7 Democratic votes to avoid a federal government shutdown. It isn't as clear that that's going to happen this time. So you keep talking about the continuing resolution. We're sort of used to that. That's how the government operated last year. What do you think is going to happen here? Are we into sort of continuing resolution land, or is there finally going to be kind of a showdown about the budget here?
Yeah, well, as I mentioned, the debate really is about what is in this continuing resolution. And so, to your point, I think the Democrats have a little bit more leverage now to try to get some of potentially a policy compromise included in the CR. And so the big debate right now is does Congress want to address the expiration of the enhanced premium tax credits for buying insurance on exchanges? So for Minnesota, that's in MNsure. These are set to expire at the end of the year. It's got quite a significant impact on the cost of insurance for those who buy off of the exchanges if those are not extended. So, Democrats are hoping that maybe that could be addressed in the CR, but
I think a few Republicans I've been reading.
Absolutely, yeah. So I think some of the Republicans are recognizing the importance of these tax credits to their constituents and how costs will rise. So there is debate if that will be included in the CR, but I think we're really just seeing how the politics will play out, and we'll see.
So tell me a little bit about what hospitals are doing to make their case in Washington here.
Yeah, so MHA recently sent a letter to the full Minnesota congressional delegation really outlining all these issues that we talked about. In addition to sort of those urgent priorities with the September 30th deadline, the letter also included some priorities for the end of the year. And in addition to those ACA premium tax credits that need to be addressed, the other big one is a payment cut that potentially may go into effect as a result of the One Big Beautiful Bill Act. And this is called PAYGO cut. So basically, if legislation is passed that increases the deficit, then they have to cut spending in another way. And this really could hit Medicare reimbursements. Congress has avoided this in the past and waived it in the past, but we do need to make sure this gets done by the end of the year, or hospitals and health systems could suffer an additional payment cut.
So a lot of drama ahead in the weeks to come. We'll have you back, and you can update us as the budget marches on.
Sounds good. Thanks, Tim.
Again, that's Becky Wifstrand, the Minnesota Hospital Association's Director of Federal Policy and Regulatory Affairs. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.